Welcome to the next episode of the Microbiology Tube. So today we'll be talking about the randomized control trial. So the randomized control trial is a kind of the study design which is usually used to check whether any kinds of the drugs or the vaccination is useful for a treatment, for a disease treatment. So here the word random, we have to know about the word randomized, which means the random. So here the randomization is called because the sample population is randomly assigned to the treatment group and the control group. So this is called the randomized control trial. So here the treatment, in the treatment group we apply the interventions. So intervention is applied in the treatment group. The interventions may be the new drugs or the vaccine. So in the control group, no intervention is applied. So no intervention is applied in the control group. So after the treatment, after the applications of the interventions is the treatment group, we look for the follow up, whether there is the change in any kinds of the disease or behavior in the treatment group, and we also check whether there is any kinds of change in behavior of the control group. For example, if we are talking about the blood pressure, so for example a new drugs has been made which claims that drugs will decrease the blood pressure, so we apply this to the treatment group, whereas we don't apply that intervention is the control group. We left the control group in the nature, you know, we left this control group in the natures to check the to check any kinds of the changes in the nature, and here the treatment group means that is the changes made by these drugs. So after the administrations of the drugs in the treatment group, we note whether there is the changes in the blood pressures of the individual. We check whether that is the blood pressure is decreased or not. So similarly in the follow-up also we will check whether the people have decreased the blood pressure due to the nature or not. So the results from A and the B will be compared to calculate the risk ratio. So in the case control study we use the odds ratio, but in the RCT, randomized control trial, and the cohort study, we will be using the relative risk ratio. We cannot use the relative risk ratio in the case control study, and we cannot use the odds ratio in the randomized control trial. So you see what is the relative risk. So it is the ratio of probability of event occurring in the exposed group by the probability of the event occurring in the non-exposed group. It means the probability of occurring in the exposed group. Suppose the PE will be the A by A plus B. So probability of occurring in non-exposed group will be C upon C plus D. So if we take this ratio of these two, that is the ratio of relative risk ratio will be the PE by the PN. So that will be the your relative risk ratio. So now let's talk about one example. So there is one medicine called the aspirin. So this is aspirin is the medicine. So whether we know whether the aspirin will increase the myocardial infections or not. So use of aspirin will increase the myocardial infections or not. So so in the one treatment group we have given the aspirin, and in the next group we have given the placebo. So now you can know whether the probability of aspirin to increase the myocardial infections will be the 139. So this will be your A, this will be your B, this will be your C, and this will be your D. So by the total, that will be this one. So 11037. So similarly the probability of the placebo for occurring the myocardial infections will be the 239 by 11034. This means, what does this mean? A by A plus B is equal to C by C plus D. So now if you take the relative risk ratio, the relative risk ratio will be as mentioned, PA upon PP. So that will be the relative risk ratio, and this is your calculated relative risk ratio. So the relative risk ratio here is, the relative risk ratio is 0.58. So it means it is what is it is less than 1. So it is less than 1. It means there is an indirect relationship between the myocardial infections and aspirin. It means the aspirin not increases but decreases the myocardial infection. So this means that the aspirin decreases the myocardial infections. If the relative risk ratio is smaller than 1, so it means the effect is negative. So it means the effect is negative, and relative risk ratio is equal to 1, so it means there is no effect. And if the relative risk ratio is greater than 1, it means it increases by some percentage. For example, if the relative risk ratio was, suppose for example, if the relative risk ratio was 1.75, so what does this means? This means that 75% increase in myocardial infection. So if it was this, so 1.75 means 75%. So you have to take this one, 75% increase in the myocardial infection by aspirin. So this is all about the calculations of randomized control trial, and you know what is randomized control trial. So if you have any queries related to this, please don't forget to comment me in the comment box, and please share, subscribe and like the video. Thank you.